नमस्कार दर्शकवृन्द, म कालो टेलिभिजनमा हार्दिक स्वागत छ। दर्शकवृन्द, स्वास्थ्य क्षेत्रसँग सरकार राख्दै जानकारीमूलक स्वास्थ्य कार्यक्रम नोबेल स्वास्थ्य दर्पण लिएर हामी उपस्थित भएका छौं। आजको कार्यक्रममा हामी न्यूरो रोग र त्यसको उपचार प्रक्रिया बारे जानकारी दिनेछौं। हामीसँग विगत 6 महिनाबाट नोबेल शिक्षण अस्पतालमा मृगौला सम्बन्धी उपचार सेवामा कार्यरत चिकित्सक प्रोफेसर डाक्टर एडमण जोनाथन कुन्द हुनुहुन्छ। डाक्टर एडमणले भारतको भेल्लोर स्थित क्रिस्चियन मेडिकल कलेजमा 10 वर्ष कार्य अनुभव सँगालिसक्नु भएको छ। उहाँसँगको कुराकानी अघि कार्यक्रममा अस्पतालमा उपचारका लागि पुगेका बिरामी र आफन्तको भनाई प्रस्तुत गर्नेछौं।
मलाई टिम्बर भएर स्पाइन टिम्बर भएको यहाँ 13 दिन भइसक्यो। अब सबै त ठिकै छ, अलिक हिँड्न प्रब्लम भएको छ अलिकति। डाक्टर साहबले भन्नुभएको छ 1-2 दिन लाग्छ। पहिला आउँदा त समातेर आउँदाले पनि अलिक समातेर नै हिँड्नुहुन्छ, अलिक त्यस्तै छ। अलिक हिँड्नमा खाली प्रब्लम छ।
यहाँ चाहिँ खासमा पहिली समस्या भएको चाहिँ पहिले प्रेसरले गर्दाखेरि योभन्दा 1 महिना 2 दिन अगाडि लडेर पछाडि टोयलेटमा बाथरुममा लड्नु भएको थियो। अनि लिएर आउँदाखेरि अनि यहीँ सरहरूले अपरेसन गरेर फर्स्टचोटि अपरेसन गरेर सक्सेस भएर घरमा लगेर 1 महिना राखेको। 1 महिना राख्दै सबै नर्मल भएको थियो। 2 चोटि सरसँग आएर चेक पनि गराएँ मैले। सरसँग आएर चेक पनि गराएँ। पछि फेरि 81 बिहानखेरि 10 बजेतिर हल्का टाउको भारी भारी भयो। अब नुहाएर फ्रेस हुन्छु भन्दाखेरि बाथरुममा भाउजूले लानुभएको छ नुहाउनको लागि। नुहाउन लाँदाखेरि दाजुलाई रिङाटो चलो भनेर 81 भुइँमा बस्नुभयो क्या। बसेपछि अब थाम्न सकिएन, धेरै वेट भएको थियो नि त, एकदम 125 किलोसम्म वेट छ उहाँको। अनि त्यही भएर थाम्न सकिएन। अनि फोन गर्नुभयो, बोलाएर अनकन्सियस हुनुभयो। अब पुरा 15 मिनट जति होस हरायो दाजुको। होस हराइसकेपछि उहाँलाई त्यहाँदेखि पुरा हातहरुमा उयसमा खुट्टामा मालिस गर्दा रिलिफ हुनुभयो, होस आयो। त्यसपछि अनि एम्बुलेन्स हतार बोलाएर यहाँ पहिलेकै ठाउँमा यहाँ नोबेल ल्याइयो। इमर्जेन्सीको पनि न्युरो इमर्जेन्सीमा हामीले त्यहाँ सरहरूलाई देखाएर अनि उपचार सुरु गरियो। उहाँको अवस्था चाहिँ एकदमै सरहरूको भनाइअनुसार चाहिँ सम्भावना 20% मात्रै छ भन्नुभयो। अनि त्यति भनिसक्दाखेरि अब हामीहरूलाई डिसिजन गर्न एकदमै गाह्रो भयो परिवारलाई। अनि अब म भाइको नाताले अब कस्तो हुन्छ भने परिवारलाई त थोरै 1% नै चान्स हुँदा पनि त केही गरौँ भन्ने हुन्छ हैन। आफ्नो पैसाभन्दा ज्यानभन्दा ठुलो कुरो त पैसा हैन नि त। त्यही भएर हामीले सोच्यौँ बुझ्यौँ। पहिले सरहरूले एकचोटि भन्नुभयो 60 र 40 को डिफेन्स छ भन्नुभयो। पछि त्यति गर्दै फेरि सरहरूले अहिले उयोहरूको चाहिँ पैसाहरूको नभर्नु, एकछिन पर्खिनु भन्नुभयो। त्यो पछि फेरि दाजुको अवस्था अलिकति त्यो मिर्गी जस्तो, नेपालीमा भन्छ मिर्गी जस्तो भएर अलिक धड्कन सबै डाउन भएछ। धड्कन डाउन भएपछि तपाईँलाई 45 थियो मुटुको धड्कन डाउन भएर। अनि क्रिटिकल अवस्था भइसकेपछि सरले फेरि बोलाउनु भयो मलाई र अफिसमा हामी मिटिङ गऱ्यौँ। मिटिङ गर्दाखेरि एकदम लास्ट चान्स भनेको 20% भनेर भन्नुभयो। अनि त्यति भइसकेपछि धेरै गाह्रो भयो। अब हामीलाई पनि अब पहिले यहीँ गराएको, अब फेरि त्यो पहिले र अहिलेको समस्या चाहिँ बेग्लै समस्या भएको छ कि। पहिले चाहिँ टाउको ठोकेर ब्रेनभन्दा माथिको मात्रै अपरेसन भयो हजुरको। अहिले चाहिँ फेरि टाउको ठोकेर भित्र नसामा समस्या भयो। अनि त्यही भएर चाहिँ अब 20% चान्स भन्दाखेरि अब धेरै अतालिम। अब म्यानेजमेन्ट गरेको पनि अब गाह्रो भयो। पछि अब 1% चान्स हुँदा पनि गरौँ, जसरी भए पनि गरौँ भनेर हामीले डिसिजन दियौँ सरहरूलाई। सरहरूले राति लगभग 9 बजे 8:30 बजेदेखि सुरु गर्नुभएको होला। 9 बजेदेखि मैले सरहरूलाई एकदम रिक्वेस्ट गरेर अब उहाँ इन्डियादेखि आउनुभएको एकदम स्पेसलिस्ट सर अनि प्रकाश काफ्ले सर उहाँहरूको टिम लगायत गरेर मैले एकदम पर्सनल रिक्वेस्ट गरेँ, गरिदिनुहोस् प्लिज, जसरी हुन्छ तपाईँहरूको बेस्ट दिनुहोस्, हामी हाम्रो तरिकाले प्रे गर्छौँ होइन, भगवान्लाई सम्झिन्छौँ भने। त्यो भएर हाम्रो दाजु आज सक्सेस हुनुभयो, अहिले अपरेसन सक्सेस भयो, त्यही सबभन्दा खुसीको कुरो। र उपचार राम्रो होस् र यहाँबाट एकदम दाजुलाई सकुशल लान पाइयोस्, त्यही मात्रै सरहरूसँग र अल टिमसँग मेरो यही एकदम मुरी धन्यवाद।
Hello everyone, I'm Dr. Sanjita Khatun from Nobel Medical College. I extend a hearty welcome to all of you in today's program, where we'll be having a short interaction with Professor Dr. Edmund Jonathan Gandham, who is a senior neurosurgeon in Nobel Medical College. He had been working in Christian Medical College in Vellore in India. Hello sir.
Hi Sanjita.
Where did you complete your neurosurgery from?
Yeah, I did my neurosurgery from Christian Medical College, Vellore. I finished my residency in 2013. Since then, I've been working as a faculty in Vellore, and it's almost 10 years now, approaching 10 years in neurosurgery.
When did you pass out?
In 2013.
Okay. So how did you decide to come to Nepal, sir?
We had a very short visit by Dr. Indra Sharma and Dr. Niranjan to Vellore briefly in last year, and they expressed their interest in having me here in Nepal in Nobel Medical College, especially in Biratnagar. They showed keen interest in setting up and helping the progress of the department. As you know that Dr. Sunil Sharma was very instrumental in establishing this Nobel Institute of Neurosciences, which caters to different specialities of neurosurgery. So I was really interested to see the setup, and I paid a visit in the month of August 2022, and I met Dr. Prakash, who is the senior neurosurgeon there, and they have shown me how the department is and what the work structure is. So I was really impressed with the setup, and they were very keen in bringing up good neurosurgery to services to the people of Biratnagar. So I extended my greetings to them and expressed my interest to come and work here for a couple of years. So it's been 6 months that I'm here, and we have done a lot of good neurosurgical cases, and the outcomes have been good.
So why did you choose Biratnagar? Why not Kathmandu? We all know that Dr. Sunil Sharma is affiliated with Kathmandu Medical College also, but you chose Biratnagar. Why is that?
I chose Biratnagar because of the closeness to India. That's one, the primary thing, and the ease of transport. And the important thing was that this setup that we have right now, which was started way back in 2017 with a vision to offer the best neurosurgical setup, has been the keen interest for Dr. Sunil Sharma and his team, and they have set up a very good neurosurgical setup which is not available anywhere else in Nepal. To me, I feel this is the best neurosurgical setup here, so I felt that I can improve and share my skill set and upgrade the current scenario. And as you know, Biratnagar is closely bound by a larger population, and it's close to Indian border. So I felt that my interaction with Indian population also would be there. So these are the two mandates that I had in my mind before I narrowed up on the decision to be in Biratnagar.
According to you, what is the significance of neurosurgery?
All right, Sanjay, neurosurgery is an elite field of surgical specialties. It's also called as the king of surgical specialties. It's a complex branch. Training is vigorous. It deals with complex brain disorders like stroke, aneurysms, brain tumors, and vascular pathologies. Then innumerable causes that are very commonly seen in this part of set of surgical specialty. Neurosurgery also deals with the complex spinal surgeries like spinal tumors and spinal diseases, vertebral body tumors, degenerative spine like sciatica, in the common terms what people can understand, and degenerative lumbar disc, and Also, neurosurgery deals with acute neurosurgical setup in presence of trauma. As you know, that trauma and road traffic accidents are on a rise in India and in Nepal, which form the major burden, and neurosurgery plays a key role in delivering fast specialties and acute care that will help for the good outcome of the patients. So neurosurgery has a many spectrum underneath it, and each thing needs a special care and special attention. And regarding the training, why neurosurgery is important is it's important to get a very good training and a vigorous training. And it almost takes almost 14 to 15 hours of your working time during your residency. Even now, after 10 years of completing neurosurgery, I do work hard. It's the passion that you need to develop, and you need to have attention to details in each and every aspect. And that forms the core of delivering neurosurgery. And the important thing about neurosurgery is it cannot be performed by one person alone. It needs a team, a dedicated team of neuro anesthetist, an intensivist, a good ICU setup, a good operating setup, and of course, without your juniors and without your colleagues, you cannot run the show. So all this put together, these facilities are important to bring up a good neurosurgical practice. And we have that setup here in Nobel Medical College.
As a neurosurgeon, what are your roles particularly?
As said, as mentioned earlier, the main important role for us is to be a good trauma surgeon, to help take care of the trauma, which is road traffic accidents and its burden, to help the spine patients, because which forms a major burden of degenerative spine like lumbar disc, then lumbar tumors, then spinal infections and spinal abscess, and to operate on complex spinal pathologies, and in order to deliver a good treatment for the brain tumors, which forms a major burden in a neurosurgical aspect. And here in Nepal and here in Biratnagar, especially because of the hilly terrain and closeness to the Himalayas, we have seen an acute rise in vascular pathologies like stroke, hypertensive bleeding, and there is increased burden of subarachnoid hemorrhage where the patient has blood in the brain. And delivering a fast and accurate treatment brings a big outcome, makes a big change in the life of a patient. So these are the few examples that we need to deal.
So can you highlight about the subspecialties in neurosurgery?
Yeah, Sanjita, that's an interesting thing. The subspecialties are numerous subspecialties are there in neurosurgery, like functional, vascular, spine, and pediatric neurosurgery, neuro-oncology, neurotrauma. Everything put together is a different thing.
Okay.
But the things that I'm interested is vascular neurosurgery and spinal neurosurgery, which is the major burden that I can see here in this particular set of patients that I'm seeing here. And for example, we have a patient who comes to you to the emergency department with a sudden drop in his consciousness because of a headache or because of any event. Immediately we need to do a scan to see what it is. So we need a facility where you can quickly rush the patient to a CT scan, which is available here. And after that we need to do, suppose it is we are dealing with a vascular lesion, we need to do an angiography. We have a high resolution CT angiography that helps us to localize where the bleeding is from. And immediately we need to rush into theatre based on availability and the willingness of the patient. So once patient is ready, we are ready on the go to clip the aneurysm, and we have all the facilities available here. And regarding trauma, we have recently launched and we are recently practicing minimal invasive spinal surgery. And I am a trained fellow in minimal invasive spine surgery recently, and I have passed out in 2019. I received a special training in South Korea. This helps in improving the patient outcomes. In minimal invasive spinal surgery, as compared to traditional spinal surgery, you don't need to make a long incisions. The operation time is reduced, blood loss is reduced, where we are able to put and deliver with the small incisions. The hospital stay, it reduces the burden to the patient. And we have done successfully almost 10 minimal invasive surgeries so far, and patients have had a very good outcome.
So you have been working in Nobel since 6 months.
Yeah.
So what would you like to tell about its infrastructure? What comment would you like to give?
Yeah, I've been working here for the last 6 months. From the day one to the day currently that I am in, I'm really happy with the setup that they have. For example, the theatre and ICU and the wards are closely in one floor. That makes a big difference, because if we have any patient who has deteriorated in the ward, we can immediately rush to the ICU. And if this patient requires theatre, we can immediately take him through the ICU into the theatre in a short duration. That helps in making a big difference when you are in a rush to save the patient. And we have a good ventilator setup and good ICU, which is adequately spaced with good nursing staff who are trained. And we have latest facilities in theatre like in-prop MRI, which will help us to decide how much tumor is left behind without waiting for the patient to be woken up and do an MRI after the surgery. So this will help to improve the patient outcome in the people, those who are affordable for that. And we have O-arm and navigation facilities that will decrease the amount of radiation that the patient and the nursing staff and the doctors are exposed, in order to deliver high-end specialty surgical specialties in terms of spine surgery, long duration scoliosis surgery. We are able to do it effortlessly. And these facilities has helped me to continue to deliver good services here so far.
So would you like to talk about the availability of all the materials required for whatever branches you have talked about?
Yeah, that's the other thing that I wanted to highlight. As soon as I came to Nobel Medical College, I had a meeting with Dr. Prakash and Dr. Pramod, who had been the neurosurgeons here for the last 5 years. And I expressed my interest in developing minimally invasive spinal surgery. We had meeting with Dr. Sunil Sharma and Dr. Niranjan and Indra Sharma also. I expressed my interest to bring in the things that we had developed in Velo and what I use them, because it's better to use the things that I'm comfortable with. And they were readily willing to do that, and they have always took an extra mile to bring in difference to the patient outcome. And as mentioned, the minimal invasive spinal surgery that we have used, all the products that what we are using in Christian Medical College are being used here. And this is a boon to the patients in Biratnagar. We are in process of developing endoscopic spinal surgery, which I am specialized in. So we are in process of starting the services soon in Nobel. We are in process of acquiring the instruments from Korea. And I also thank the admin and the finance department who have been working hard to make my stay comfortable. And as we know, we are all working for the benefit of the patient.
So what are the scope of diseases treated in Nobel Medical College Teaching Hospital Neurosurgery Department?
We are able to treat all the spectrum, and especially vascular is good, and degenerative spine is good, and we are able to treat complex brain tumors, those which have never been done before. We are able to do that now. This will definitely be beneficial to the patients. So now the people doesn't need to run around to go to Kathmandu or different places in India to get the treatment. We are able to deliver the high-end neurosurgical specialty treatment here with the good results.
So can you give an example about a case that got benefited because of your presence in Nobel in this 6 months?
Yeah, we had operated one brain and one spine. An illustrative case. We had a patient who had come to us with a very large tumor measuring almost 8 to 10 centimeters, which has been refused by a few local centers who has refused to operate because of the size of the tumor. And we planned a surgery, and we could finish the surgery. It lasted for 9 to 10 hours. With use of navigation and with the use of advanced neurosurgical technique, we could take out the tumor completely. And we did confirm the tumor removal by doing an MRI, except for small bits. Almost 90% of the tumor was removed. And the main goal is do no harm to the patient. So we were able to give the patient the life that he had before. And he's a successful patient. We have many successful stories. In terms of vestibular schwannoma, this is the common tumor that happens behind the ear. And operating this tumor is not that easy, because anybody can take out tumor. But to have a functionally intact patient, a smiling patient, the patient with a good facial function, as you know, everybody is worried about cosmetic result. Because of availability of intraoperative nerve monitoring to localize where the facial nerve is, the nerve which is associated with the facial expressions, we were able to fine-tune our surgical skills, and I was able to leave behind a very thin sliver of tumor, with intact facial. We operated so far 5 of these cases, which was not done before, with a good facial now preservation. And these tumors are now successfully undergoing treatment for the residual tumor. We have many examples, but these are the few illustrated things. Recently, we had operated on aggressive spinal hemangioma, which is known as the spinal aneurysm. This tumor is difficult to deal with, and you need a lot of expertise, good anesthetic team, and good surgery fellows who have assisted this before. So with the team that was available here, we were able to execute the surgery well with patient back to his neurological status. He is a washerman, he is a poor patient, and Nobel, because of its policy, is able to help him financially to an extent. And we had many NGOs who were helpful to pay in and contribute something to it. And we delivered a good care for him. For example, his hemoglobin starting was 13, it fell down to 5 within 10 minutes of surgery. So you can experience what would be the adrenaline rush that we were having, and we have a good effective neuro anesthesia, neurocritical care and neurosurgical team to bring a successful outcome. And patient is fit to go, he's going to get discharged in a day or two, and we confirmed by a post-operative MRI and there is no tumor there. These are the many success stories that would follow eventually. My aim of my presence here is to deliver a good specialty services, to inform everybody in Biratnagar and local areas adjoining in Indian borders, to say that and that we are able to do a best services here in a neurosurgical setup and at an affordable price.
Would you tell something about the treatment outcomes in Nobel Medical College in Neurosurgery department?
Yeah, we had we always have to remember that we cannot have 100% good outcomes. We have good days.
Particularly in neurosurgery department.
Yes, in neurosurgery.
We all know that.
Yes, we have good and bad days. So far, I would like to put that almost the percentage of good outcome that we had is almost close to 85 to 90%. 10% of the patients do have infections, do have bad outcomes in form of death, because the outcome always depends on the condition at which the patient presents to you with. We have many patients who come to us in a last stage, and it's important to deliver the care immediately, but due to the personal reasons, financial constraints, they take time, and the time is money in neurosurgery, and time is brain. So we have the facility to deliver acute treatment, but it's important that patient realizes that opting for a treatment at the correct time is important. I would like to say we have almost 85 to 90% good outcome, and we do have our bad 10% of the people who had problems, but this is accepted worldwide.
So what kind of cases come to our hospital?
We have increased burden of vascular pathologies, tumors and a degenerative spine. So we have subset of all these patients. We don't see much of functional, and we want to develop a good skill center here for spine surgery and advanced skull base, because this will help for attracting more patients.
Like particularly if we talk about stroke, sir.
Yeah.
Would you like to highlight something? Would you like to give some message?
Yes, stroke, as I said and as I highlighted earlier, at the outset stroke is a big burden, and timely treatment and intervention is very important. So we are starting our neurointervention procedure soon, where we would be able to, even when a patient comes to with stroke, we would be able to go in and remove that part of blood clot that is causing the problem. And we also planning to improve our vascular setup in terms of offering bypass surgeries for those patients who require increased blood flow to that particular area of the brain which he is facing the problem. And regarding aneurysms, we do have an excellent setup. We have all the clips available and all the facilities, and we have done a clipping of complex aneurysms here before, and also now we tend to increase our skills day by day. And as I said, stroke is an important thing. The message that I'd like to convey to the people here is that timely intervention is important. Time is brain, so the outcomes will improve once we intervene on the right time.
So would you like to tell about the fact that many patients, they visit India for different kind of treatment? Now that there are so many things available in Nobel Medical College, what do you have? Any kind of
yes,
message
Sanjay,
for
the
that?
message is clear now to the people in Biratnagar, especially in terms of neuro, which I am in dealing with. We have an excellent neurosurgical setup here. We have, I'm there, Dr. Prakash and Dr. Pramod, these are senior neurosurgeons, and we have excellent staff and good nursing facilities that are available. And CT, MRI, which are the crux for diagnosing the neuropathological diseases, is available. We have a good neuropathology team. So I would request people to come and see and experience the treatment here. And we, with the setup that we have, and we wish to expand further, and we will be able to deliver high class treatment. And sooner or later, we're going to have a condition where people are going to be coming from across the borders to get treatment here.
What are your future plans, sir?
Future is important, right? I had a couple of discussions and rounds of discussion with the admin team, and I expressed my interest to develop a center of excellence here in skull base and in spine surgery. So right now the entire world is moving towards minimal invasive procedures and endoscopic spine surgeries. Endoscopic spine surgery is where the patient doesn't want to have a scar. So for example, nobody would like to move around with a huge scars, trying to go for a swim or trying to wear the dresses, fancy dresses, they would not be able to, and they feel shy. So we have to move ourselves with the current trend. So the entire world is moving towards cosmetic surgery and less invasive, that is minimal invasive surgeries. We already started minimal invasive spine surgery here. Our next step is to start biportal endoscopic surgery here, which I'm trained in. We are going to run parallel courses with CMC Velo and with South Korean team. We're going to have a memorandum of understanding, and we would like to establish a continuous program where we have exchange of knowledge and exchange of skill and exchange of surgeons, and this would continue to help progress the department in a better way.
Okay, so any final message for our viewers?
Final message, I'd like to say neurosurgery is a complex disorder, and neurosurgery cases are difficult to treat. It's important to get the best treatment in good hands. So I'd like to say to people and all the viewers that we have all the facilities of neurosurgery and different pathologies that we deal with in Nobel Medical College. So it would be a great boon for patients in Bharatnagar to utilize this facility and come and experience us, and they can share their success stories in the days to come.
Thank you so much, sir,
Thank you,
for
Sanjita.
sharing your time with us,
Thank you so much.
informing us and giving all the messages
Yeah.
required in this community.
Yeah.
Thank you so much, sir.
Thank you, thank you.
प्रोफेसर डाक्टर एडमण्डसँगको कुराकानी प्रस्तुत गरिसकेका छौं। प्रोफेसर डाक्टर एडमण्ड ब्रेन ट्युमर, मेरुदण्डको नसा च्यापिएको, ट्युमर पलाएको लगायत समस्याको दूरबीनको माध्यमबाट शल्यक्रिया गर्न अब्बल मानिन्छन्। हस्त यही जानकारीका साथ दर्शकबिन मकालु टेलिभिजन र नोबेल शिक्षण अस्पतालको सहकार्यमा निर्माण भएको स्वास्थ्य सम्बन्धी नोबेल स्वास्थ्य दर्पणको आजको निर्धारित समय सकिएको छ। अर्को साता यसैगरी हामी फरक विषय र चिकित्सकसँगको संवाद र जानकारी लिएर उपस्थित हुनेछौं। आफ्नो स्वास्थ्यको ख्याल राख्नुहोस्, नियमित स्वास्थ्य परीक्षणमा ध्यान दिनुहोस्। नमस्कार।